it targets, for some reason, the pelvic area, and I think it's due to, from what I've read about different kinds of waves and wavelengths and frequencies and that kind of thing. A lot of those things are very dependent upon, like, they'll go to certain kinds of waves are attracted to certain parts of your body more than others. So, like, a certain kind of bone density in your body might attract one kind and be very painful for one area. A different kind of technology is going to target and affect another part of your body more because of the way that your blood is grouped in that area, or the water content, or the density of your bones. So some of these things are very calcium, bone, they're drawn to that kind of thing, sort of like a magnet. And anyway, this very unusual pain began while I was at this barbecue, and it was the people that were there. The one man was a U.S. Army, and this was a barbecue for this woman that I'd worked for. I worked for her while I was pregnant, or while I was pregnant for most of my pregnancy. And she was from Argentina. And she came to the United States and married a U.S. Army man by the name of Russ Strong. And they had a few friends there. There were probably only 5 people there, maybe 5 to 7, including me. And one individual was a police officer. And then, while I was there, I began having just really odd and very not normal lower back pain, and I was being observed, and I noticed that I was being watched closely. And I noticed that a couple of the people weren't very nice to me. Like, they looked like they had a hidden agenda. They were mad about something, but I didn't know what. I mean, I wasn't sure why they wouldn't like me. A couple of the people I had never met before. The pain got to be so bad that I couldn't even walk. I had to have somebody's arm in assisting me to my car. And I wasn't having labor. It wasn't like it wasn't like a normal labor thing, because I know what that feels like. And it wasn't, at the time, they later said, well, you just had a urinary tract infection. But I accepted that as an excuse, but I don't think that was what was going on. I know for a fact that the pain that I felt in my lower back was the exact same pain from the technology that was directed against me and my son after he was born, about a year later. Again in East Wenatchee. So I had to have the help and assistance of leaning on somebody, literally, to get to my car, and then I had to drive straight to the emergency room. I remember that the police officer was sort of mocking me, was kind of laughing, and I was like, and I wondered, there was something off about the way he was acting. Like, he was really gleeful, like kind of sadistically gleeful about something, and didn't like me. I just picked up on his feelings towards me, and I knew something was wrong. But at the time, I wasn't thinking, I'm being targeted, and these people know it, and they're observing me. I mean, I just thought, I don't know what this pain is, I have to go to the hospital. And it was only later that I was able to figure out that, okay, that pain there was the exact same thing as how they tortured me and my son later. So I did get myself to the hospital. I was 7 months pregnant, and once I was there, they said I was having premature contractions. So then they ran a couple of urine tests, and they said that I had a urinary tract infection, and they gave me an IV or a shot or something, and said that, I believe they gave me an IV, and they said this will, and a shot. They gave me a shot to stop the contractions. And, honestly, really, after having so many bizarre things done to me, and so many people lying, I really don't know what they gave me. I mean, they could have given me a shot of anything. But whatever they gave me did stop the contractions in addition to the IV, or, what they said were miniature contractions. And if I was having miniature contractions, it was because the amount of pain that I was having from the technology directed towards my back. I was not so fat at that time that I was having problems carrying. And I typically, and after that situation and before, I never had a problem. I was in pain when I was around this U.S. Army person and a police officer. And like I said, I was later able to pinpoint that as the exact same pain as was targeted against me and my son later. Like a year later, after my son was born. When I wasn't carrying any kind of a child, obviously. And as for Olga, his wife, this U.S. Army person's wife, she was Italian-American and something else from Argentina. Her family was Argentinian. So, when I had when this happened, prior to this happening, I said I was having, I remember that possibly I was having some of that pain in my lower back even at my house on Methow. But then I remember it was very, very bad at this house with the Army person and the police officer, to the point of suddenly disabling me within 2 hours. But I think that a low level of it was possibly happening at my house in Methow, and my son and I were later tortured at that same location after he was born. So it's not impossible that we were being targeted there first. And I did go to Dr. Butler and I said, maybe I'm having a little bit of pain, maybe something's wrong. He said, no, probably the baby's head is just in a weird location, it'll change. And then after they said that I had a urinary tract infection, I went back to Dr. Butler and I was really upset, and I said, well, they said I had a UTI and you didn't check for that. But the thing is I was going to him, and I was also going to Stacy Stubblefield. And Stacy Stubblefield was the midwife who was in a different federally funded clinic, and her husband is a police officer for Washington State. And she was doing regular urine tests, like where you pee on a strip and whatever, and it checks for all kinds of things. There was no indication, and urine samples, there was no indication that I had any kind of UTI. So it's actually possibly not even true that I actually was showing up with a UTI. And given the fact that I had a false THC diagnosis, from that hospital, it's also possible that somebody was trying to torture me or harm me or my son, or do some sort of experimental thing against us, and then lying about it and covering it up by claiming there's a natural reason for it, such as UTI. Which is not an unreasonable thing for me to think, because I discovered later that my migraines were triggered by military, and they used my menstrual cycle as the excuse for that. So there have been several things that have happened to me where different natural-looking things are being attributed towards instances of torture. So this is a really shocking thing, I think, that happened to me while I was pregnant. 7 months pregnant, and that happened. There was, I only remember there being like 4 or 5 people there maybe. We were at someone's house, and I think it was her, this woman, and her husband maybe. Then it was Olga and Russ Strong. And then there was this police officer. And maybe one other person, but maybe not. Maybe it was just me. I just remember that when I was leaving, the police officer was also leaving. So anyway, the next thing that happened was so then then Dr. Butler got really upset. Oh, and I told him, well, he knew that I had been treated for this UTI, and I didn't accuse him of anything. I didn't bring it up to accuse him for not treating me or anything. I just said, she said it was an UTI, and he just didn't say anything. And here I was, thinking it myself that, and I won't say anything because he knows he didn't do what he's supposed to do. But, thinking about it in hindsight, he probably already knew that it had nothing to do with UTI or the head position or anything. I mean, but then all of a sudden he prescribed this huge bottle of Vicodin for me. And he wanted me to pick it up, and this is after I wasn't being tortured anymore. And I didn't pick it up, and he said, well, aren't you going to take this, the narcotics that I prescribed? And I said, no, I don't have the pain anymore, so I don't want to take them. Why would I take them if I don't have any pain? So I left that bottle there. And yet, I mean, there was no reason why I would try to deliberately take something that, even if it didn't cross the blood-brain barrier for developing fetus, I just preferred to stay away from that kind of thing if I could avoid it. So then the next thing that happened is I was Stacy Stubblefield. Also, when I went to her as midwife, she told me, I told her the same thing that I told the other midwife. Let her know that my first OBGYN said my pelvis was too narrow and I needed a C-section. And that's why I went to her, because she had closer hospital rights, just in case. And she checked me, she admitted, she said, yes, it is narrow. It does look too narrow in one aspect. She said something about, I don't remember what it was. There's this way and then that way, or something with the pelvis. And she said in one regard it was too narrow for a natural delivery. And then she said, however, when you are in labor, oftentimes the hormones and the different things will allow your body to relax, or the bones to, different things to expand and allow for passage of the child. And so she said we can always just see how it goes, and then if it looks like it's not going to happen, then we can have a C-section. So that sounded very reasonable to me. Of course, I thought, well, yes, if I can have a natural childbirth, that would be great. But thank goodness, because I'll be right there in the hospital, and most likely I'll need a C-section, and it won't be a problem. So then I also got a doula. I went online, I was talking to some different people. Somebody brought up this idea to me, I don't know who, and I don't remember where, but they brought up this idea of doulas. And I said, well, what's that? What's the difference between a doula and a midwife? Because here I had this OBGYN. And he was mainly in charge of my migraine control. And then I had this midwife who was going to be the person to help me deliver it as naturally as possible, I thought. And then someone's bringing up this idea of a doula, and I didn't know that I needed a doula. But as explained to me, they said it's a very natural thing. The doula will help you and assist you. She'll be like an advocate during your labor and will assist you at your house. First, you will labor at your house, and then she will know when it is the right time to go to the hospital.